Hey, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to talk about picking the right bracket prescription, specifically 022 versus 018 slot, and the whole Roth, MBT. There's so many different prescriptions, and I have a whole different video on the prescription part, the Roth, MBT, all that. But today I'm specifically going to talk about the slot size, picking 018 versus 022. And really it comes down to personal preference and how you were trained and probably what they used in your residency or what they used in your class that you took. You just do what's comfortable for you. So it's nothing I can demo that you would notice with your naked eye. It's really just down to like how things handle. Every orthodontist uses, I find more orthodontists use 018, more DSOs use 022. More GP dentists use 022, but that doesn't mean one's wrong or right. So I'll kind of tell you the differences, what I notice, and you can pick your own personal preference. The main thing you need to know is that you need to pick one, stay with one, and that's the bracket you use. So if patients transfer in from another provider, that's the first thing you're gonna ask. Is this 022 or is this 018, and what is the prescription? Unless it matches with the bracket that you're using, now you can have an 022 Roth from one vendor and an 022 Roth from Ormco and one from 3M, and you should be able to mix and match. Like if you take that patient and one of their brackets breaks and they lost it, you can use one of yours, even though it might be from a different vendor, it should perform the same way. I don't know if that makes sense. If your bracket prescription doesn't match with the transfer, then it's a risk because first of all, you're gonna take a look and say, do I love the bracket positioning? Would I change anything? You know, and if the patient was like 1 month from being done and everything looked perfect, and you wouldn't change a single thing, then you're probably okay to keep it. But if the patient's only halfway through treatment, probably better, unless that doctor sent a pile of, a set of brackets as a backup. It's probably better if you pull all those brackets off and put your brackets back on, because you're gonna be in trouble if the patient breaks and loses a bracket. Or later down the road if you decide to reposition a bracket. I don't know if that makes sense. So patients don't love that, but that's how it is. Okay, so let's get down to the 018 versus 022 thing. So 018, I've used both in practices. I'm pretty capable of using one or the other. I'll come into a practice or take over a practice, and I just use what they have. I mean, as long as I don't use tip edge, that's the one thing. It's a whole different system. It's a whole different bracket shape. That is not something I'm trained on. It's totally weird and different for me. So no, that's not something I do. Nor do I train doctors who want to do tip edge. It's not me. So I just do standard mini twin straight wire. So 018 is going to be a smaller bracket slot. So see this slot right here? Slot, 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 okay? Your naked eye can't tell the difference between an 022 and an 018 slot difference. You can't. You're talking a couple hundredths of a millimeter. I mean, you can't see that with a naked eye, right? But the one thing I like about 018 is I actually use less wires. I don't have to inventory as many wires because the max wire size I can put in is an 1825. I can't put in a 1925 into an 018 slot. I can't put in a 20 by 20 or anything like 21 by 25. Don't need those because I'll never use them, right? So that's the good part for me. It's less inventory. Number two, I start to see torque being expressed earlier because I'm filling the slot earlier with lower force wires. Personal preference, okay? So that's, if I'm opening up hypothetically a new shop and it's only me working there, that's the bracket I'm using. I'm using 018 Roth. That's just something that I like best. But it's also a little trickier to get those wires in because it fills the slot sooner with a lighter wire, etc. So it's a little more technique sensitive. So I don't recommend GPs use 018 Roth. I recommend they use 022 Roth or MBT. It's pretty similar prescriptions. Again, watch my other video on the difference between those, but you need to stick with one vendor. They're just subtle differences between a certain orthodontist. Like, I like this much torque on a lateral, or I like this much tip on my molar. You will not notice any difference. Your patient will not notice any difference. Try to keep it consistent, because if you have one lateral that's one type and one lateral that's another, they're not going to be symmetrical, which is why you need to keep your patients symmetrical. So in a nutshell, again, I recommend general dentists use 022 because it's technique easier. you most likely aren't going to be using the hugeoid wires anyways and filling the slot 100%. The only time I do that is when I need max torque, or if I'm trying to get some expansion on an arch and put in a steel wire or something like that, then I'm going to max out the thing. So I mean, it's really not going to make any difference. I think it's going to be easier for you to manipulate, easier for you to use, easier for you to train people using 022 slot. Hopefully that was helpful. Thanks.